Health is a state of complete physical, mental, and social well being, and not just the absence of disease. Today, we have with us a homeopathic doctor who has completed her MD and who provides homeopathic consultation and treatment to patients at NiTARA Homoeopathic Clinic, her private OPD clinic, for 2 years. She also has experience of teaching Materia Medica to undergraduate students. She believes in applying her knowledge of medicine to treat the patients and to improve their health and well being to the best she can, and also to create awareness amongst the society about the physical, mental health, and hygiene, thus making the world a better place. So, to know more about homeopathy and her, let me welcome Dr. Suchita Gandhi. Hi, Suchita, how are you?
Hi, Amrita. I'm fine. I liked your introduction. It was short and cute.
Thank you so much. So, how does it feel to be on the other end? Because now I'm asking questions and you have to answer. So, do you feel do you feel like the patient today?
Yes, a new experience, or maybe I may recall my Viva days, or when I
Oh.
had to answer questions.
I hope not to make it that difficult. You won't be marked for this, don't worry. So you can answer however you want. So, Suchita, I just want to dive right in and ask you, can you tell the listeners about your journey and what drew you towards learning homeopathy?
Okay. Well, my journey wasn't any different than others
Mm-hmm.
because I had completed my 12th standard and I was ready for my entrance exams.
Right.
But the thing was quite clear in my mind that I wanted to go into medical field
Mm-hmm.
because from right the start, like I was drawn towards science, or maybe inclined towards more towards science as a subject, biology in 11th and 12th,
Right.
and basically the human body.
Mm-hmm.
So that was quite clear in my mind that I wanted to go for medical field. um, I had 5 options before me, like dentistry, physiotherapy,
Mm-hmm.
Ayurveda, homeopathy, and of course your modern medicine.
Correct.
But after my entrance, I did not make it to modern medicine. And physiotherapy and dentistry, I wasn't that interested
Right.
into it. And Ayurveda, like, because homeopathy was what I knew a little.
Mm.
Because when I recall my childhood days, um, I had this recurrent tonsillitis, and where doctors had advised me for operation of the tonsils, and my parents then quickly took me to an homeopathic physician,
Right.
where I think within a few months I was like all fine. So I remember till date that thing, and that is why I opted for homeopathy. And also my acquaintances, like my sister's friends, and they are quite into homeopathy. So then I opted for it. So that's how I went into it.
Okay. But you just mentioned that there were five sciences altogether. So, what, according to you, are the similarities and differences between these, between homeopathy and, the other sciences?
Actually, many people think that homeopathy and Ayurveda are something different, or maybe they don't teach some clinical subjects as in anatomy, physiology. But
Right.
to make it clear that we all have 5.5 years duration of interval, like this course is of 5.5 years,
Mm-hmm.
and we are into all the clinical subjects like anatomy, physiology, biochemistry, pathology, gynac,
Right.
and plus we also have our own homeopathic system of medicine subjects.
Okay.
So we need to cope up with both of them. And the only thing that is different is the system of medicine. Okay,
Mhm.
the way we approach patient and the way the modern medicine approaches,
Mhm.
and the therapeutic part, like the medicines we prescribe, in the way we prescribe, that is different. But until the diagnosis of the patient is like, as long as diagnosis is concerned, I think everything is same.
Okay. Okay. So I thought like it was completely different for, homeopaths and the other sciences altogether. So you have to study every single thing. And after, the only thing is that you are taught about homeo medicine rather than the other sciences. That's it. That's the only difference.
Right.
But you have to
Yes.
learn the entirety of it. Okay. Quite
Yes. Yes.
interesting. So I understand that there are a few principles of homeopathy that everybody is to understand before we go into the depth of it. So can you just tell the listeners about that?
Yes. Um, Basically, in Sanskrit, it's
Hmm.
quite an old proverb. It goes like, uh, I'll just recall it.
Yes.
Vishaya Aushadam Visham.
Uh-huh.
Okay. So
Mhm.
that means poison kills poison.
Ah.
Like in more simpler words, like cures like.
Uh-huh.
Okay. So a short story, or maybe a little bit making it a little bit interesting, is
Right.
our founder, that is Dr. Samuel Hahnemann.
Mhm.
He was a modern medicine practitioner himself.
Okay.
Okay.
Mhm.
He had done his MBBS and also MD, and he was practicing in his own clinic.
Mhm.
But somehow he wasn't satisfied with the way of treatment that was available back then, and because there were certain diseases which were not being able to cure by allopathy, and that is why he just conveniently left it. And as he was quite well learned, and he had good linguistic skills as well, so
Uh-huh.
he went on to translating books of
Right.
chemistry, of medicine. So he went on to translating them, and he came across a line in one book that mentioned cinchona bark. Okay, this goes a little technical, but
Okay.
cinchona bark, it's a medicinal substance,
Uh-huh.
quinine, that is used for malaria now also, like
Right.
in modern medicine,
Mm-hmm.
to cure it, to treat it. So it mentioned that it cures or treats malaria because of its bitter properties.
Mm-hmm.
Now he became skeptical about it, and he said not all substances that are bitter actually cure malaria.
Hmm.
Okay, so what he did was he experimented it on himself. He took some parts of cinchona, and he for good 2 to 3 days,
Mm-hmm.
and once he saw the symptoms, he stopped it. So that time he realized that he actually got malaria like symptoms.
Oh,
So he was amazed at it. Yes.
right.
So what he did was he started experimenting, and this huge concept of drug proving comes from homeopathy,
Uh-huh.
where we have such vast literature on drugs that we have proved on healthy individuals
Mm-hmm.
and noted down all the symptoms, whatever come, like mind, body, whatever symptoms are there, they are noted. And he
Right.
did a good experimentation of 90 drugs. After that, he discovered homeopathy, and
Right.
that is what is the story behind it. Like when people say it is not proved science, I really feel they are very ignorant, because they don't know this literature at all. Yeah.
Yes, that is
And
correct.
even Hippocrates had mentioned, like in his scriptures, like father
Mhm.
of medicine, if you must be knowing
Yes, yes,
Hippocrates.
yes.
So he had mentioned about like cures like. So yeah,
Mhm.
it dates back to those days. And the
Mhm.
second principle that I would like to focus is another, is that is dynamization. We actually
Okay.
potentize our drugs, and people say that your drugs do really, they do have medicines. Like, yeah, they do have medicines in it, because we rather concentrate on the quality than the
Uh-huh.
quantity of it. Okay.
Correct.
There are many researches going on, like in IIT Bombay, one research is going on wherein, they have concluded that homeopathic medicines have nanoparticles in them, which work as medicines.
Mhm.
So these are the basic principles of homeopathy, which I would like to,
Okay.
introduce to the audience.
Hey, this is very interesting, yeah, because absolutely I had no idea that poison kills poison. This concept is completely new to me. But when you explained it, I realized just recently we have all taken vaccines and we've got a little bit of COVID-like symptoms, and that is what is creating that immunity. So I guess that is how medicines were discovered. That they discovered that
Exactly,
our
that is the
body
same
can take it.
principle.
Yeah, same principle.
Yeah.
So is there a crossover somewhere, where modern medicine and homeopathy crossover somewhere? Is that possible? Does that happen at any point? I'm just asking as a layman.
Yeah, actually, I don't think so, because modern medicine uses some huge amount of drugs. They have chemicals which are huge amount, and
Correct.
we in turn we just have very little sufficient to make a cure and
Right.
also nullify the side effects.
Okay.
But yeah, the principles somewhere,
The
about this
principles of
vaccination.
creating the medication is the same, but
Yes,
there's very little. Basically, you just
very
follow the same structure or the rule book, but the medicines are different. Got it.
correct.
Got it.
And like our principles never change.
Mhm.
Whatever be the disease, our principles, that it forms a foundation. It is a
Right.
foundation of the basic homeopathy. Like, and modern medicine may also, they prove their drugs on animals. Like
Hmm.
we
Hmm.
have animals as well as human bodies, which actually human bodies pe zyada karke, it is kind of more. It makes it more original.
Correct. That's true. That's true. Absolutely. So, of course, there's this question that always comes when in alternative medicine: is there a particular diet to be followed when being treated? Because when you usually do Ayurveda, you are asked not to take certain foods or substances that interfere with the treatment. Is it similar for homeopathy?
Yeah, actually, there is no hard and fast rule into it.
Hmm.
But we advise people that as far as possible, eat cooked onions or eat cooked garlics,
Hmm.
or if at all you're eating raw onions or garlics,
Hmm.
just have a gap of of 30 minutes interval time between your medicine and the food.
Oh, okay.
Yes, like 15 to 30 minutes is fine.
Uh-huh.
And also, there is this thing that coffee nahi lena chahiye,
Uh,
and tea, coffee se problem hota hai. But there are only certain medicines that can interfere with the coffee intake.
right.
So when we prescribe those medicines, then we ask the patient that thoda sa coffee, thoda kam kijiyega, like for 15 days or somewhat, not lifelong.
Okay.
Yeah, but again, again, अगर disease के साथ तुम आते हो, so
Huh.
I need to tell you that if you have diabetes, I need to tell you that please cut down on sugar, cut down on fats. So
Yeah.
that is the only diet we will be saying or we will be advising,
Uh-huh.
and a little bit of onions and coffee and garlic,
Right.
not hard and
You just mentioned diabetes, right? So I had one query for you. When it comes to long term diseases like diabetes or blood pressure, where people are taking medication for a longer duration of time, and they come to you for homeopathic treatment, do you ask them to continue that medicine and then you prescribe them your treatment, or do you ask them to quit that completely and then start on your course?
No, actually, quitting those medicines is not really an option,
Okay.
because they are taking it for years
Right.
and their body is somewhat got used to it,
Right.
and we cannot quit it so soon.
Mm-hmm.
But yeah, we can control, because there are some patients taking anti-diabetics,
Mm-hmm.
but their sugar levels don't seem to come down.
Right.
So doctors को dose बढ़ाना पड़ता है, you have to take insulin injections, and so there we play a role that we can at least come and control the sugar as much as possible in
Right.
the patient.
Okay.
Okay, and if at all it is of 6 months duration, abhi abhi diagnosed hua hai, we
Mhm.
can handle those cases well.
Hmm.
But I think you need a good experience, and I think everyone should go to a good homeopath, like be sane enough. And even on the part of homeopathic doctors, they
Hmm.
shouldn't quit it, or they shouldn't do such things that
Drastic
will mess up with
actions. Yeah.
patient's health.
Right.
Yeah,
Right. 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 So
we
it
should
is
be
like
very
a
careful about
gradual process of mixing,
it. Yes,
understanding both sides of it, both sides of
yes,
the
yes,
pathies.
because it is not the pathy, it is the patient who comes first. The
Right.
pathy is secondary. You
Right.
don't need to just enforce on patients that nahi aap yahi lo, aap homeopathy hi lo. No, so that shouldn't be the case.
Acha. So that is important. Okay. I also had one more query. So usually when the first time I came to you, you asked me to do a complete psychological analysis where you asked me questions from my childhood till what I did till now, and you put me into a very big thought process जो हमको बचपन से भी यादें नहीं थी वो सब यादें करवाई. So why is it interested? Why is it important? Why are you interested now?
Yeah, why
Why
am I
is it
interesting in
why
here?
are you interested in my life?
Interesting,
No. So why
right?
is why is the study of
Actually,
psychology important?
you have studied homeopathy real well. Let me tell you this. You are doing a good research on homeopathy. But yes, see, homeopathy, when I say it is a holistic science,
Uh-huh.
what I mean is we take into consideration the mind, the
Mhm.
body, and the diagnosis. Okay,
Right.
these three are important.
Mhm.
So when I say mind, why is the mind important?
Hmm.
To make it a little more in medical terminology, I'll say that I had also told you, I guess, hypothalamus pituitary adrenal axis.
Yes. Yes.
Okay,
Mhm.
ये
Mhm.
चीज होती है where this controls the immune system of our body,
Mhm.
the gut, the digestion, each and every part, the hormones, the metabolic things that go on in our body. And whenever there is a stress, they try to compensate. The body compensates any kind of stress in any person.
Hmm.
But once this compensating mechanism is lost, the body cannot longer process the stress, and
Hmm.
each person reacts in a different way to a stress, to any
Right.
given particular stress. Some
Hmm.
people are calm, some people experience palpitations, some are under frustration, irritation, and this eventually dictates the diseases in you. Okay, for example, if at
Hmm.
all you are a person who is always anxiety, always having anxiety, you are having palpitations whenever there is some bigger event or something like that, and these people ought to have complaints relating to gastric headaches,
Hmm.
acidity. This is just
Oh,
a part. Okay,
right,
but
right.
your mind dictates your body a
Hmm.
lot. No two people are common.
Hmm.
Okay, nor a person's fingers are alike.
Right.
Everything is different. So when a person relates to a stress, they relate it differently, and they react differently.
Hmm.
Even if you have migraine, recurrent headaches, I mean, I have recurrent headaches.
Hmm.
Okay, but the medicine will differ. We want that unique symptoms from you, and
Hmm.
homeopathy comes in play like this. Like if you have cold and you
Right.
are better by hot drinks, but I have cold, I'm better by cold drinks. So this is what we want in homeopathy. This plays no major role in modern medicine. They don't
Okay.
want to know it, but we want to know it. That how are you felt better? Like how
Right.
are you aggravated? So
Uh-huh.
these are things that make you unique, make you as a person unique.
Mm-hmm.
So first your diagnosis,
Mm-hmm.
your mind, how you cope up with the stress, and
Mm-hmm.
that stress, वो stress में तुम कौन हो? Okay,
Hmm.
how you manage it, and so the patient comes first, the disease comes secondary.
Correct.
Because you are sick over here, your body shows it.
Okay, so now I have two questions for you. One, is it possible to cure a disease just because you said it is in the mind? So, is it possible to, learn how to control our mind and in turn affect our body as well? And secondly, I have noticed this that one medicine in homeopathy is used for different diseases as well, which completely depends on the personality that a patient has. So, can you tell the listeners a little bit about both of these things?
Yes. So we when I as I mentioned earlier in drug proving, we have
Hmm.
mind symptoms as well. मतलब एक healthy individual को लिया
Hmm.
voluntarily,
Hmm.
ये सारे drugs proven है already since many
Right.
ages. Okay, we
Right.
don't need to prove it now and then every time,
Hmm.
but these are the some things that are proven.
Hmm.
So we have a set of mind symptoms like ये patient is irritable. Why
Hmm.
is he irritable? What is it that makes him irritable? तो
Correct.
ये चीजें हम लोग स्टडी करते हैं, पेशेंट में स्टडी करते हैं कि
Hmm.
आपको क्या होता है जब किसी ने आपको कुछ गुस्से में बोल दिया, हाउ डू यू रिएक्ट,
Hmm.
व्हाट आर योर सिम्टम्स, एंड अकॉर्डिंग टू इट वी हैव अ मेडिसिन. ओके,
Correct.
तो
Hmm.
अभी कोल्ड के लिए एक मेडिसिन भी एक ही मेडिसिन कोल्ड के लिए भी चलता है, हेडेक्स के लिए भी चलता है,
Acha.
एसिडिटी के लिए भी चलता है,
Mhm.
बिकॉज इट हैज दैट स्पीयर ऑफ एक्शन. ओके,
Acha. Correct.
अभी सपोज इफ आई टेल वी हैव अ मेडिसिन फ्रॉम आर्सेनिक एल्बम, यू मस्ट हैव हर्ड इट.
Yes.
कोविड में वो
Everyone.
बहुत ही
Everyone
फेमस हो
is
गया
using
था.
it. Correct.
Yes. So Arsenic album, if you read it, you will be so amazed. Like the Arsenic album symptoms of mind, they have mere anxiety,
Hmm.
mere fear of diseases. Like,
Hmm.
अरे मुझे ये infection हो जाएगा. I have to constantly wash my hands. I want it everything clean. I want everything clean. I want everything at its place.
Hmm.
तो ये जो चीज और उसके साथ साथ उसको जब सर्दी होती है, okay, so he's better by warm, he's better by good hot drinks. तो
Hmm.
ये सब symptoms. और अभी अगर आप देखोगे, बीच में when there was this flare of COVID, everyone was so anxious. Like
Yeah.
it was actually fearful. That is a common reaction of everyone. But जिसमें वो pathological हो जाता है, जिसमें वो एकदम हावी हो जाता है,
Hmm.
किसी भी किसी to that extent that he constantly washes his hand, constantly has to sanitize. That is something abnormal. Okay,
Hmm.
so
Hmm.
एक बार sanitize कर दिया हो गया.
Hmm.
Constantly कुछ ना कुछ कोई करता है. So that is where we take out those symptoms and then give a particular remedy.
Right. 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 Well, about the part of mind curing the body, just in case we take some kind of help and understand our own symptoms or our own workings, then does that help with controlling some
Yes.
kind of diseases? Does that happen?
Yes, why not? When you manage your stress,
Mm-hmm.
because stress एक ऐसी चीज है कि वो आने ही वाली है.
Correct.
उसको कोई नहीं रोक सकता, ना हमारे होम्योपैथिक मेडिसिन, ना कोई भी मेडिसिन. Stress is a thing that is going to come and on, like, and that is the moment where you need to wait, introspect yourself,
Uh-huh.
meditation. हम लोग that is why we also counsel our patients. When
Right.
a patient comes to us, we assure him that you will be good. Like, we need to assure him from the point of daily activities as well, that you need to meditate, you need to exercise, you need to
Mhm.
vent out the stress. Unless and until you're not going to do all of these, nothing is going to happen. Like,
Mhm.
kuch acha nahi hoga. So
Correct.
if you're going to just keep on taking the stress, it's only going to harm your body.
Correct. So it works both ways. So even the medicines help, and it
Yes.
is very important so that you control your stress as well. So,
Mhm.
coming to this fact, when you say that it's all in the mind, there are people who say that homeopathy is a pseudoscience. They believe that medication works only because it is a placebo effect, and otherwise it doesn't work. So, what are your thoughts on this? And in what
Yeah.
cases or diseases, would homeopathy be effective, and in what cases should somebody, go for alternative pathies? So, these are the two questions that I had for you.
Okay. See, when people say it is pseudoscience,
Yeah.
I would like to tell them that, we have our literature. Just I told you, we have
Yeah.
such a vast literature, more than 1,000 books, and we need to study so many things. And it is developed since ages. I told you, it is not just
Correct.
a science that developed in one day. Like, आज homeopathy discover हो गया, कल इतने सारी books निकल गए. नहीं. It has been experimented. It has been studied. We confirm it in our clinics, we
Hmm.
reconfirm it from the patients. So I would like to say, why would have anyone wasted time over this? Why would have they wasted their time over, you know, uh, going on
Yes.
with literature, nikalo, itna sab kyun koi waste karega time? And secondly, there are so many eminent MBBS practitioners
Mm-hmm.
who have converted themselves to homeopathy.
Acha.
I can't name them, but yeah, for now I can't name them. But there are so many people, so many doctors that I know, and they teach us homeopathy as well.
Hmm.
Like, it is such a brilliant thing that they are doing so well, just because they know that homeopathy works well in patients,
Mm-hmm.
and it does not have major side effects.
Hmm.
So they have converted themselves. Plus, अगर pseudoscience की बात किया जाए, तो we always strive to maintain a evidence-based science. At least I do that in my clinic, and in many colleges we have these researches going on.
Mm-hmm.
Plus, I feel that it is very important to have that evidence-based science, because if you go retrospectively, ठीक है, आपको सीधा नहीं जाना, आप पीछे से जाइए, you
Hmm.
can see how we have before treatment reports, after treatment
Correct.
reports.
Hmm.
वो ऐसा होता है ना कि if you have a negative thing, and if people want to put you down, they will always pick at you with that negative point. वो ऐसा हो
Yes.
जाता है.
Correct.
So it's people see you don't know how your medicines work, so it is not a science. That
Mm-hmm.
is not a way to conclude it. Every अगर तुम research पढ़ रहे हो ठीक से, there is retrospective study as well, so you
Mm-hmm.
can go from that way and also find out so many things about our science.
Right.
And also, जब वो placebo effect का आता है,
Hmm.
I would like to mention that we treat babies right
Hmm.
from 6 months of age, infants, and we treat children for their allergies, for their cold and cough, and
Correct.
recurrent diseases. So how does placebo play a role in them? Like,
Correct.
come on,
Correct. They are
babies can
so they
tell
have no
themselves, "Arey, mom,
idea.
dawa le liye." And and many stalwarts in our field have actually treated comatose patients as well for a
Oh.
speedy recovery.
Oh. Oh.
Yes, they are quite experienced, and matlab, so I don't think placebo plays a effect in them also.
Mm-hmm.
Matlab, also one thing, we as doctors hold so much of responsibility of a patient's life in our hand.
Yeah.
So we cannot just for a serious illness हम ऐसा नहीं बोल सकते, हाँ ये दवाई ले लो आप, हो जाएगा ठीक. मतलब नहीं, इन्फेक्शन है तो कैसे ही प्लेसिबो इफेक्ट से कम होने वाला है.
Yeah.
So
Yeah.
I deny.
Done. Definitely. I believe you. Of course, it has been effective for so many people. And I also have been treating with you. So I definitely know the, function of homeopathy. But I just wanted to know, as I asked you before,
हाँ.
that is there a crossover somewhere, where somewhere you feel okay, homeopathy works till this point, and then I might have to send them for alternate medicine. So does that ever happen?
Yes, definitely. See, as a doctor, you should know the
Mhm.
limitation of your science and
Mhm.
also the scope. Okay.
Correct. Correct.
If there is an emergency patient in front of me with cardiac arrest, with symptoms of stroke, I really need to admit him or really need to have that intervention of allopathic emergency medicines. I
Mhm.
cannot say कि नहीं मेरी medicine से हो जाएगा, नहीं. Even in surgical cases where there is a foreign body in your eye, there is a foreign body in some part of your body, in spine or somewhere, there is a growth for
Hmm.
that matter, or there are fractures. You
Correct.
obviously you need to mend it. You cannot say that nahi homeopathy se hi hoga. So these are the limitations.
Yeah.
Okay, like when such sudden emergencies come
Correct.
within you, with in front of you, you cannot say that. And homeopathy is useful in fevers. Okay,
Hmm.
I
Hmm.
would
Hmm.
say in acute conditions and infections, in chronic diseases like children's disorders, kidney stones. We expel
Oh.
kidney stones as well with our medicine.
Oh, really?
So thyroid, yeah,
Okay.
thyroid again, kidney stones again. It comes with not all kidney stones where
Huh.
you need where you need surgical intervention. We will advise you that no, you need your surgical intervention.
Correct.
Okay, so you need to have a good judgment of it
Hmm. Hmm. Hmm.
when you
Correct. So you should
actually.
know the limitations. Otherwise, of course, as you said, the pathy comes later. It's the patient who comes first.
Yes.
So that is very important. So, well, people have one more complaint that, homeopathy takes a lot of time to act. So what is your say on that?
Yes. Like what I feel is if you have a fever since 2 days,
Hmm.
I wouldn't expect it to disappear, or I wouldn't expect it to go away in 1 week's time.
Hmm.
No.
Hmm.
Like if you have fever of 2 days, I know within a day you should be fine, you should
Hmm.
feel good.
Correct.
Okay. So it is that way that like in chronic conditions where suppose you are having a skin condition, chronic as in I mean a disease which is lingering since many years, for
Correct.
more than 6 months, for more than a year.
Hmm.
So such diseases, I cannot expect it to go just within 15 days. ऐसे गायब नहीं हो सकता है. Disease
Correct.
is something कि chronic condition में I can assure the patient that you will feel the recovery. मतलब recovery तुम कर दोगे जल्दी. The recovery starts within 15 days. You are sure to be free of that disease within some few months, but
Hmm.
it depends on your disease, the pace
Correct.
of your disease.
Hmm. Hmm.
अगर आपका पेस स्लो है तो थोड़ा सा स्लो ही जाएगा नीचे,
Correct. 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 So it
like
has been
but
lingering for a
not
long
years
time. So
and years.
yeah, 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 yeah. So
Hmm.
it takes that much time to at least reverse the effects of whatever has happened.
अगर आपको सर्दी खांसी बुखार है तो वो कम होना ही है 2 दिन में, so there is no option for that.
Achha. Suchita, moving on to the next question. This is something that I read about on the internet, that there are three levels of homeopathic therapy: first aid, acute homeopathy, and constitutional homeopathy. So, can you just tell the listeners in detail about it? Or is it something that is, too technical that we should not know about?
No. No, I'll explain it to you in a very simpler way,
Haha.
that these are just fancy terms, nothing else.
Okay.
But yeah, the first aid thing,
Uh-huh.
when I say that homeopathy is not for emergencies,
Mhm.
but I will also say that if a patient comes to me with
Mm.
a very sudden abdominal pain, मतलब पेट दुख रहा है, बहुत दुख रहा है, and it is kind of appendicitis का पेन है, या kidney stone का, या तो some acute abdominal emergency, till he goes to the hospital or till the help arrives, I can definitely make him feel better by my medicines.
Right.
Okay, तो वो थोड़ा सा पेन कम हो सकता है.
Mhm.
When you have menstrual cramps, dysmenorrhea जिसे बोलते हैं, पेट दर्द करता है periods में,
Mhm.
so even that homeopathy can actually make you feel better. So homeopathy comes for the rescue over there. So that I think is the first aid thing that you're talking about, because
Right.
we didn't have this first aid thing in our portion, like homeopathy in
Okay.
first aid, but it is interesting. And acute infections, be it viral, be it bacterial. Okay, so
Mhm.
homeopathy comes to the rescue for such infections as well. So you can actually opt for homeopathy as a primary line of treatment.
Right. And what about constitutional homeopathy? What is that?
Yes, so constitutional homeopathy is nothing but that I mentioned earlier, that
Mhm.
whenever a patient comes with a chronic complaint with a duration of many years, like his disease has been lingering,
Right.
since many years. So we consider his body symptoms, his physical symptoms as in, and
Mhm.
his diagnosis
Mhm.
and the mind.
Right.
Okay, what caused this disease in him, or maybe we analyze a little bit more, and
Mhm.
the present state of the patient at that very moment. What is he feeling in his mind? Plus the physical symptoms and the
Mm.
diagnosis. So that is again that comes into constitutional thing.
Okay, so there are three levels which I've understood. One is first aid, acute, and constitutional. Okay. Interesting. So, well, now I guess I there's this one thing that is going on around us, which is COVID, which is not going away. So, since we are
Mhm.
going through a pandemic, and there is new variant coming up every single day. Like yesterday, I saw
I
a new
know.
variant in the
Wake up.
newspaper. So, I have a two-part question for you. One is homeopathy effective in such cases, and two, what do you do to keep up with the research in such cases?
Hmm. Yes, COVID is homeopathy is actually helpful in such cases.
Hmm.
I in my clinic I have had patients with influenza like illness,
Right.
query COVID,
Hmm.
sometimes COVID positive, and
Okay.
they have actually been doing well with homeopathic medicines. But again, a doctor should be able to judge where this patient can be managed on whether this patient can be managed on clinical basis, or
Mhm,
he actually needs a hospital admission, he needs an
mhm,
ICU referral. Okay, so
mhm.
that again there's a thin line between it, and you need to judge it very sane enough, like sanely.
Correct.
And again, there are in the last wave, in the second wave
Mhm.
last year,
Yes.
there were many hospitals in Pune and Mumbai where they had given homeopathic medicines and allopathic medicines in ICU.
Yeah.
Okay, for the study purpose, and they actually saw that when given homeopathic medicines
Mhm.
plus allopathic medicines, the patient recovered soon and he was discharged soon. Plus, there was no post-COVID illness in them.
Right.
Okay, compared to those patients who were on allopathy in
Mhm.
the ICU. And you can also, like, if anyone wants to check, they can also go and check this article on PubMed. Like, PubMed is a genuine research organization article
Okay.
thing. So
Mhm.
on PubMed also this is published. So
Mhm.
this was the conclusion that homeopathy actually helps as an adjuvant with allopathic medicines in the
Right.
ICU as well.
Okay. So
And
yeah,
hmm,
I'll add
yeah,
I'll
yeah,
add
go
the
on.
links in the description so that people can get in.
Yes,
Yeah.
sure, sure.
So were you answering the question related to the research part?
Yes, right.
Okay.
The research part, uh, this in any science, research is very important. Like we need
Mhm.
statistics, we need which medicine is better, like how does this medicine cure a certain disease, and how much
Mhm.
does it cure. So this is very important. And as a PG student, we
Mhm.
were actually introduced to it. We had a thesis submission over it as well, where
Mhm.
we needed to research on a particular topic with our homeopathic medicines. And
Mhm.
there are many institutions, like to name them, one is in Palghar,
Mhm.
okay, which is an amazing college with an hospital linked to it, where allopathic doctors also work as well as
Okay.
homeopathic doctors work for the
Mhm.
betterment of the patient. So there also constantly researches are going on.
Mhm.
uh, Again in Kolkata there is one NIH institute, National Institute of Homeopathy. So
Mhm.
there are also researches going on. But I think the main research is in our clinics. Like when you are in a clinic and in day-to-day practice, you actually maintain a record
Mhm.
that is like enough for an evidence-based science again. So
Right.
whenever you need some statistics, some analysis, you can very well go and just um, refer to your record keeping things and again research. So this research is very important. I think every doctor should maintain a record of it, and so
Mhm.
that it actually helps for the later
Right.
studies.
So, as you said, it is an evidence-based science. So, first you understand the patient's symptoms and then provide medication and then just observe how they're reacting to certain things
Yes,
and then keep on
yes,
changing it accordingly. Right.
yes.
So, well, coming to the humanly side of you, apart from being a doctor, what do you like doing in your free time? Or do you take free time at all?
Yeah. Yes, I do. So I think, in my free time I love a bit of dancing here and there. Matlab,
Okay.
I like Yeah, so that is a way where you, again, if you pursue your hobbies, half of your stress is vented out there and there. So again, that is again one thing to cope up with your stress. So I like traveling, I like dancing, and I like reading a bit here and there, like
Okay.
novels. Not that much, but yes, so I do these things in
Right.
my free time.
If you have noticed, she just said that, to vent out the stress. She did not say I enjoy doing it. She has used medical terms here as well, so the doctor never
So okay,
leaves her.
I enjoy doing it.
The doctor is not out of her even when she's in leisure. That's amazing. So Suchita, what message would you like to give, the up and coming doctors in your field?
Yes. Actually, I think not only in my field, but when a person decides to become a doctor, I
Mhm.
think the main thing that you should have in you is empathy.
Right.
You should know that patients come to you for your help and not take them for granted anyhow. And also don't think that after you passed out your college days and you are gone, you come out with a degree, and the very next day patients are going to flow in your OPD, like be it any science,
Yeah.
be it even if you're an MBBS doctor, an Ayurveda doctor, or an homeopathic. And on homeopathic doctors, the pressure is more. Like the initial years, you have to struggle. You have to invest your time in going to hospitals, developing your skills, and that is where you need that hard work. You need that perseverance, and I think वो mindset रख के ही you should enter into a medical field,
Mhm.
and making a difference in someone's life, that should be your motto when you sit on that chair of, when you are consulting a patient, when you are on the other side of the table. So that is what ऐसे चीजें मन में लेकर आओ, that you need to make a difference in his life, and that is where half the things are sorted.
Wow.
So don't run out behind money like ekdam pehle se hi, I want to earn and I want to, because it's going to be very disappointing and very disheartening at first,
Mm.
but later you are really going to be, respected, and you will be making a difference in people's life. That is what
Yeah.
I want to say.
No, even I have observed because I've seen you, as a friend and then as a doctor. And we had a different equation back then, and the way you conduct yourself behind that table on your chair is completely different. You have got this beautiful, even though it's a stoic expression where you don't smile a lot, but you're like, okay, nahi, aapko jo bhi bolna hai, aap bol sakte ho, main sunne ko taiyar hu. So you have that expression on your face, and it really helps, when somebody's coming and cribbing about their problems and talking to you. I won't say cribbing, but then when you're
Yeah, yeah.
really frustrated, you feel like venting out to somebody, and it feels really nice to be heard. And I understand what you say when you say that somebody has to be really empathetic to be a doctor. It's very
Yes,
important.
thanks.
So coming to the final question of the questionnaire, which I ask everybody on the podcast, and that is why it is named so. What does the phrase "being settled" mean to you, beta?
Yes. Firstly, your podcast is really amazing. Like, you are really, I think you are making a huge difference by creating this also. Like, there are so many different ways of making a huge difference in this world, and you're doing one of them.
Thank you.
So that
Very
is
kind.
good. And also, I like the name, the unsettling podcast. Like, it's good. And being settled. For me, I think um, you be settled, start being settled in the materialistic world. Like, I have this car, I have this house, yes, I am settled. Don't be greedy for more. But being settled in the on the other side would be for me that don't limit yourself. Like,
Mhm.
don't put a full stop on that कि हाँ मैंने ये सब कमा लिया अब मैं नहीं, but do something more to give back to the society, or maybe achieve your goals. And in that process, don't never settle in that process. Like, make your
Right.
goals be make it higher, higher and higher, and don't settle for anything very meek.
Okay. So basically, don't run behind material things, but keep on improving as a human being, keep learning new things, and
Yes.
keep on changing. Well, thank you so much, Suchita. This has been a wonderful conversation. I've learned so much more about homeopathy, which I didn't maybe during my research. And this has been a wonderful experience. I'm sure my listeners also will learn more about this and, move towards alternate medicine. And it's not a pseudoscience. Whoever asked this, please listen to the podcast.
So you're doing a very good thing. At least through this medium, people will understand what exactly homeopathy is, and they won't be
Yes.
driven by all those myths.
Yes, hopefully that will
Thank
happen.
you. Thank you.
Thank you. So, Suchita, I just wanted to, before parting, I wanted to ask you, can people consult with you online? If that is the case, how do they get in touch with you?
Yes, they can email me, or maybe I can. I do online consultation as well as my
Right.
consultation in the clinic that is at Chinchwad.
Mhm.
So anyhow is feasible. But
Right.
जो long distance patients होते हैं, they like prefer online consulting, and then I courier the medicines to them.
Right.
So they can contact me through my number. Maybe I can, like, I don't know.
Okay. So
At all I
we
can
can add everything, whatever, maybe we can add an email ID so that people can get in touch with you because it will
Yes,
be on a public
yes.
forum. So I can add an email ID
So I
and
think
then you
email ID
can,
would be better.
yeah. So I can do that. And we will be adding all the links in the description. You can always get in touch with her. So thank you. Thank you so much, Suchita, for doing this with me. It's been a great
Thank
pleasure.
you.
Thank you.